I'm Dr. Rajetha Damisetty. I'm a dermatologist and a public health activist. On this YouTube channel, Derm Activist, I bring to you all 1 hour-long podcast being moderated by Dr. Amarendra Pandey, anti-quackery warrior from Jabalpur, Madhya Pradesh. In this hour-long podcast, we hope to cover numerous issues that pertain the ills and the threats posed by fake doctors, the current scenario in India, the problems and the solutions that we all should be fighting for. So stay logged in for more.
So to all our listeners, to all our viewers, to all our audience, to all our followers, this is an honest and earnest effort by us dermatologists of India. We have dermatologists here from all over India. We have Dr. Avinash Pravin from Kanyakumari, as we say, from Kashmir to Kanyakumari, who is an expert in spreading the correct information which should go out to each and every individual and in busting all the myths. He has done a lot of work in his own state, in his regional languages as well as in English. We have Dr. Karthik Raja sir with us from Chennai. He has again done a lot of work in anti-quackery, in spreading social media awareness, in catching quacks, and in saving lives of millions and millions of people. We have Dr. Akshay Samagani from Bangalore. He has single-handedly led the charge against so many quacks at the ground level in his own state of Karnataka. Plus, he has helped us out all over in India. He's always ready to travel any length and breadth of the country when it comes to anti-quackery. We have Dr. Nazia ma'am. Nazia ma'am is from Hyderabad, and Nazia ma'am has been with us in this anti-quackery war since day one. She has helped the patients at the ground level. She has helped a lot with patient education, and in all our endeavors on anti-quackery, she has been supporting us thoroughly. And last but not the least, the nucleus of this entire fight, I like to call her Rani Lakshmi Bai because most people will understand the reference. So Dr. Rajetha Damisetty ma'am is the person, I like to call her a anti-quackery stalwart rather than a warrior now. She has made sure that podcasts like this are self-funded by NGOs, by organizations, and in this case, this podcast is not sponsored by anyone else. It is self-sponsored. The only reason for this podcast is spreading awareness amongst the patients. All of us are very happy in our practices, but if we do not stop quackery right now, right here, many communicable diseases like tuberculosis, like leprosy will keep spreading in the country. You've heard recently that the superbug has spread in Delhi.
If you have superbugs in air, then we are really looking at a medical crisis.
And the reason for that again is quackery. We've tried our best. We are in courts. There are 3 court cases which are going on as we speak right now against quackery all over India. We have written to the government multiple times, but we are bringing out this podcast against quackery so that each and every patient understand how deep this menace runs. We will be attaching a link of an earlier podcast in which we have detailed how quackery, what quackery is and defined what quackery is. Right now, we are going to ask specific questions for our viewers. So this is a follow-up podcast because something really big has happened from that point to this point. So our first question of the day is, recently in the Rajya Sabha, which is the house of the elders, which is considered a house where educated people are there, where the stalwarts of the country represent their respective states. So we are very grateful to our member of Rajya Sabha, Shri Vivek Tanka Sahab, who asked a question to the government that what is the government doing about complaints against quackery in dermatology? How is quackery in dermatology affecting the person at the ground level, the patient, the innocent patient at the ground level? We were astonished, we were amused, and we were very, at a certain level, angry with the reply which the health minister gave, asking the NMC. So the NMC said they have no complaints against dermatology. Immediately, our IDVL, which is the second largest association of dermatologists, we are going to be the largest association soon, sprang into action, met the Rajya Sabha member of parliament, and we presented about 1,000 complaints which have been given to the NMC, some directly, some through the various state councils, and now a privilege motion is in the works. Soon a privilege motion will be brought into the parliament because the minister has blatantly lied. So to start things off, I will ask Dr. Rajetha Damisetty ma'am, who has been involved in this movement since day one, that how do you feel about what has happened in the parliament and about the blatant lies which the minister has said in front of the country?
The feeling is that of disappointment, at the deflection tactics, the denial, the distraction tactics that we use, because the reply to this very apt question whether unqualified or unregistered persons are conducting aesthetic dermatology and laser treatments, whether such practices have resulted in harm or fatalities. Now, in 2025, May, two deaths came to light, and both these deaths were in Kanpur. Both these deaths were following hair transplants done, and both the patients who died were in their early 30s.
Two engineers died after a hair transplant performed by this doctor, who allegedly posed as a dermatologist but holds only a dental surgery degree.
And strangely enough, these transplants, hair transplants, were done by a BDS doctor, or you might want to call her a dentist. Now, the big question is, why did the dentist do the procedure? Now, half the country has heard of this, but the NMC has not heard of it. They have not, at least not taken cognizance of it, and it did not come to the notice of the esteemed health ministry. So what does one say about it? So we can only feel sorry for ourselves, for the whole country, and we have to get more determined into bringing these to the attention of the powers that be.
Thank you so much, ma'am. I would like to take the views of one of our legal experts in the panel, Dr. Akshay Samagani. You heard the entire question, you follow the parliament quite keenly, and you follow all legal matters of the country also quite keenly. Please tell our viewers what you feel about the same.
Hello everyone, thank you for the opportunity. When we think about the answer by them, given by the Honorable Ministry through NMC, it is really a devastating reply what it has been given. So the whole country knows what has happened, and the death of two youngsters.
स्वेलिंग बढ़ते बढ़ते उसका पूरा चेहरा खराब हो गया
because of such unqualified individuals doing aesthetic practices, hair transplant, and so on. And this has not been a single case, one or two cases which are happening throughout the country. So whole of the nation is suffering because of this. And this has been brought to the notice of medical councils throughout the country, including the state of Karnataka, where we have given 400 plus complaints alone in Karnataka state to the different strata of medical and health officials, including the district collectors, including the health minister of Karnataka. Everybody has been informed, and this has been reached the National Medical Council as well. And at many instances, direct complaints have been given to National Medical Council. The instances of the so-called quacks who are starting their own institute and giving training to them has been come to the notice of National Medical Council. How can they deny such a glaring deficiency and such a crime against innocent patients happening throughout the country? And such thing has been already brought to the NMC, but NMC and the ministry decides to give a generic answer to all the questions. Usually happens in Parliament, being an elder house, upper house, and giving such a generic answer that they don't have information is a great blunder, and it is causing a lot of damage to the belief system, that towards the democracy in whole.
Thank you, Akshay bhai. I would like to go back to Rajitha ma'am, because there is a point which she only discussed with me and brought it up. I would like her to elaborate on that. That first of all, no one asked NMC,
Yeah,
so the question
exactly.
was never for the NMC.
Yes.
So I would like to hear more about that from you, ma'am.
Yeah, that's the precise point I wanted to make, that the Honorable MP Mr. Tanka did not ask about what the NMC has done or has been informed about. It was a very general question, and there was absolutely no need for NMC to be brought into this, except as a measure to deflect and to distract the public. And the important questions were, whether the government plans to enact a central law, and whether measures that are being taken currently are sufficient, and whether there are any new measures that are being undertaken. No, none of these were addressed by the minister.
Rajitha ma'am is trying to tell you viewers is that first of all, the system to complaint is, the protocol is that you have to go through the state council. You cannot go directly to the NMC as it is. So first of all, the NMC should not have been contacted. The minister should have contacted all the various state medical councils, because the health is a concurrent subject. It lies both with the state and the central government. Instead of doing that, they took a shortcut. They approached the NMC. In that sense also, NMC lied, because they had many direct complaints against quackery. They did not bother to mention them. They didn't bother to go and ask the various state councils. And the system the rule says that you first complain to your state council and the state council will complain to the NMC. So imagine the cat and mouse game which is going on and the fool which the people are being made out to be. This is a really astonishing event which has happened.
So basically, state councils don't have to inform about all complaints, but whenever a registered medical practitioner is being found guilty of promoting quackery, and when there is a penalty imposed, then they have to inform. And we know for a fact that Telangana Medical Council has been very active, and Telangana Medical Council has recently suspended 5 registered medical practitioners on these grounds, and these complaints have obviously been, and these penalties have obviously been informed to the NMC. So we know that this is a blatant lie.
Thank you so much, ma'am. So I would now like to go over to Dr. Avinash Pravin bhai, and I would like to ask his views upon the same, and also how did this entire system of Rajya Sabha question affect the online media? Please tell us.
It is very true that we are all disappointed with NMC, that they should have supported, or they should have at least acknowledged the issue without addressing the problem. They simply told the problem doesn't exist itself. And also in Tamil Nadu, what I realized was in medical councils also, Tamil Nadu Medical Council, their views on quackery in dermatology, they are not giving much importance to those complaints also. When a same different branch complains, they are heading to it and some action has been there. But when a dermatologist complains about this quackery, which is very rampant nowadays, because skin is the most abused organ in social media also. But that kind of seriousness is not there with medical council. Now it is reflecting to the NMC. This is what it is happening.
Thank you, Dr. Avinash. Now I would like to go over to Dr. Karthik Raja, sir. I would like to ask you attend so many conferences and events. What is the feeling at the ground level amongst dermatologists and various doctors about what happened in the Rajya Sabha recently?
Basically, what has happened is it is the careless nature of the ministry itself. It shows that they don't care about the health and whatever is happening in the nation. Dr. Rajitha said they just want to distract the issue. They want to deny the issue. They want to distract the issue. They are not bothered about it. If they have bothered about it, they have seen the newspapers, things have happened. Death has happened. Even after the death has happened, there need not be any complaint. They can take action on their own. But they are blatantly lying even after having thousands of complaints in the Rajya Sabha. That shows the nature of the intent of the government. It is not bothered about it. So that is a very sad state of affair, because lot of things are about to unravel. If the government is denying there is quackery is happening in the nation, all those quacks are going to rejoice. They are going to flourish. And they are going to do more harm. That is what every dermatologist is feeling like. That is the same. Same like how air quality index, they told it is not related to lung issues. Similarly, they are telling there is no quackery. So I don't know whether we should still call them as the learned house.
Very nice. So what Dr. Karthik Raja sir has rightly pointed out is that they are lying even about serious issues like lung cancer and about pollution causing lung issues and lung cancer or not. So they are losing credibility by behaving like jokers and giving such replies. So now I would like to go over to Dr. Nazia ma'am, and I would like to ask her that has this question in the Rajya Sabha brought about any change in the ground level in the perceptions of the patients towards quackery?
First of all, even I feel it's very disappointing that such an important place to discuss our problems of the country did not acknowledge that quackery is existing and so much is happening in the country because of this, and people are losing their lives. That's the worst that could happen anywhere. It is not complained and it is not even talked about, can make general people think that it does not existing. So I think this all the doctors and all the doctors who are fighting against quackery should talk about this one and create more awareness among the people. Discussion has to come up till Rajya Sabha and also other important places. So that's what I feel, that it has to be discussed so that general people don't get wrong message because of Rajya Sabha's discussion.
Thank you so much, ma'am. So the next question is again very pertinent. First of all, there's a disclaimer before I can start with this question. Dentists are very important in this society. We respect them as fellow doctors. We call them as dentists so there is no confusion in the patient's mind. So if you have a medical problem, you need to go to a medical doctor. If you have a dental problem, you need to go to a dentist or a dental doctor. We have relatives who are dentists. We have friends who are dentists. We all go to a dentist. But the problem which is occurring here is that dentists en masse in a very large quantity are portraying themselves to be dermatologists, which is absolute quackery, which is absolutely illegal. So the same valiant Member of Parliament Shri Vivek Tanka Saab asked another question in which he asked the Minister of Health that what are they doing about the quackery in dermatology which is being brought about by dentists. Also, it was asked about what are the procedures and what are the things which the MDS maxillofacial surgeon, which are the only allowed branch of dentistry to be doing any reconstructive procedures or any aesthetic procedures as far as their reconstructive surgery is concerned. So what is their status? So now the reply was very clear, but that reply was twisted and turned. So the reply clearly said that no dentist, including a maxillofacial surgeon, can call themselves a skin specialist or a dermatologist. From the reply, the proper interpretation is that they should use whatever aesthetic measures they know for reconstructive purposes for their own cases. From an accident is there, someone's mandible breaks, for that repair, you can use whatever aesthetics you know. But what I want to tell my viewers and my audience is that, if you need to do a post-graduation in any subject, you need to have that subject in your undergraduate degree, in your graduation degree. So like we do post-graduation in dermatology, we have a MBBS curriculum in which there is a department of dermatology, in which there is a HOD, in which there are associate assistant professors, in which there are senior registrar, where we do our postings, we do our internship, and then we do a post-graduation in that particular subject. In dentistry, there is no dermatology, there is no department of skin, there is no MBBS or MD dermatology who is teaching them. To make a dermatologist, it requires 10 to 15 years. I will tell you how. 4.5 years is an MBBS degree. After that, 1 year we do our internship. That's 5.5 years. By the time the examinations and the result comes, it becomes 6 years. After that, you do either a 3-year degree or a 2-year diploma or a DNB. So that takes the tally to 8 to 9 years. After that, we do our trainings, our fellowships, our SRships. So it takes about, let's say, 12 to 15 years to make a dermatologist. Now, overnight, without any training, if a dentist starts masquerading, pretending to be a dermatologist, it is not only a normal civil offense, it is also a criminal offense. This question, when asked in the Rajya Sabha, a proper reply was given. Even the minister has pointed out that they encourage that the NMC and the National Dental Commission and the Dental Council of India should interact with each other and bring about regulations. But to our amazement, the one notification on which this entire concept lies, that the MDS maxillofacial surgeon can do some aesthetic procedures, is a copy paste of the NMC notification which the NMC brought out because the Delhi High Court instructed it to. And that same notification has been copy pasted, and the person who has signed that notification from the Dental Council of India side was not even a doctor or dentist. He was accounts officer. So with all these things, we are already in the courts. We will be discussing that in the next segment. But right now, I just want each and everyone, again, we will be starting with Dr. Rajetha ma'am, to educate our listeners, our viewers about the question which was asked, what answer was given, and how it was tried to be misinterpreted by so many people who had vested interest in them. Also, before I move on to ma'am, I would like to emphasize that not a single dermatologist till date has masqueraded or has pretended to be a dentist. It's only the other way around. No dermatologist is trying to be a dentist. Second of all, in the West, in the Western Hemisphere, in Europe and America, the people who want to do maxillofacial surgery have to do a compressed course like MBBS. Then they are allowed to do these kinds of procedures. It's not that straight away you call yourself a dermatologist, you start doing these procedures. And if this thing is not stopped, what menace it can bring about, we will discuss. We will ask our panelists to tell us. Dr. Rajetha ma'am, please inform us.
Yeah, thank you, Dr. Amarendra. That's a very important question. So Mr. Tanka had asked the Minister of Health and Family Welfare whether the DCI permits oral and maxillofacial surgeons, that's the OMFS, to perform aesthetic dermatology procedure. Now the answer should have been a straight no, because how in the world can any dentist, including a OMFS, perform a dermatology procedure? Now even the DCI's public notice dated 6th of December 2022 does not use the word dermatology. They speak about aesthetic surgical procedures. Now you can understand that if somebody has had a road traffic accident, some trauma, and they have some misplaced teeth, and then they need some reconstruction of the jaw and the teeth, then these OMFS people are very skilled at reconstructing that. But why in the world should they do a dermatology procedure? So the answer should have been a straight no. Instead of that, there is deflection, there is distraction in the answer. I'll tell you how. And the second part of the question is whether such permission exceeds the statutory mandate of the DCI, whether there is overlap or conflict with provisions of the NMC, whether the situation raises public safety or regulatory concerns. Now, the fact that so many of these dentists are calling themselves cosmetologists, now, not many of them call themselves a dermatologist, but for a lay person, somehow this word cosmetology seems to be indicating that this is a dermatologist who does these aesthetic procedures or cosmetic dermatology procedures. So I think it is very intentional that this shroud of secrecy is being put around this word cosmetology, because in fact, the government of India is encouraging cosmetology as a vocational trade training. So they want people who have completed their grade 10, passed their class 10 exam, to go and get a 3-month or a 6-month training as a craftsman or of something like your electrical trade or your plumber's training, that kind of a thing, so that they can be a trained beautician. Instead of that, these people are calling themselves cosmetologists when cosmetology is not even a medical specialty. Now, what is the thing that is giving this legitimacy to this whole dentist calling themselves cosmetologists? It is the DCI public notice. Though you have to give credit where it is due, many state dental councils, particularly the Telangana's dental council, has clearly warned dentists not to call themselves cosmetologists, to BDS people that they better not be getting into any of this aesthetic dermatology or cosmetology procedures, that they should call themselves dentists, that they should be running dental establishments or dental clinics. So there is some clarity, but the Honorable Minister of State for Health and Family Welfare did not bring out any of these important points, and instead there was a very distracting answer, if I may say so.
I would now like to go over to Dr. Nazia ma'am, if she wants to add something to this particular topic.
All of us are dermatologists. We write on our clinic's name, skin and hair clinic, skin clinic. How will it sound? I want to address the audience who are listening to the podcast. How will it sound if I write skin and heart clinic, skin and brain clinic, skin and gynecology? I have seen so many dentists portraying themselves dental, skin, hair, face clinics. How does it make sense? Because finally, it's the people. They have to judge and they have to use their common sense to decide what the doctor is doing, what credentials do they have, and what experience and what have they studied. So we can create awareness, but finally they have to decide what are they going to do. I mean, every day I get to see all of us get to see so many patients who have been abused, like they are using some cream, recently I came across a patient who underwent with a dentist a laser procedure, face laser, and it left such a bad scar. Even I was scared, and the girl's wedding was in 1 month. And last time that I came across a patient who had Q-switch and IDDAQ laser, a non-doctor by a quack, not even a doctor, and they totally burned the skin. So I feel very sad for them.
What ma'am has basically told you viewers is that the dental council is doing nothing to stop the normal dentist from doing all of these things. That is why the question was even raised in the Rajya Sabha. If the dental council was doing their job, there was no question for this to be raised up again and again. Not even a single dentist registration has been cancelled or suspended for them calling themselves as a dermatologist. The MDS maxillofacial surgeon people say that we are the only people who can do this, but they are unable to contain or control even the normal BDS people who want to do this. And in our opinion, no dentist, be it a maxillofacial surgeon or a non-maxillofacial surgeon, should be doing any dermatological procedure. And people don't have an idea that all these aesthetic dermatology procedures are actually dermatology. They are not any other specialty. So on that point, I would like to go over to Dr. Avinash Pravin if he wants to add anything to this.
Actually, what you have said is very true. Whatever the procedures, it's just a continuation of the clinical dermatology. We are giving some intervention dermatology. So without having the base of a clinical diagnosis, we cannot do such lasers without having a strong foundation. So these dentists having no knowledge of anything, naming their clinics as skin, hair, dental clinics. Some dentists don't even address them as dentists. They put the terms like aesthetic physician, cosmetologist, as ma'am said. So it's very confusing, and the dental council should take action on these people. This is our request.
Now I would like to go over to Dr. Karthik Raja sir, and I would like to know his views on the same.
To add it, you have asked a question, what is the implication of this kind of statement? See, if we allow the dental council to arbitrarily allow the dentist to do these procedures, tomorrow the nursing council will allow nurses to do LSES. Physiotherapy council will allow the physiotherapist to do the orthopedic surgery. Then where is the line ends? Because this will set a very bad precedent for the other councils to follow. If the dental council is allowed to encroach upon a medical council's field, then definitely the other council will follow. The dental council, the physiotherapy council will follow. Already they are in pathway to make themselves as doctors, and also they want to do procedures also. So if they are doing open reduction, internal fixation, and if a nurse started to doing normal delivery and cesarean delivery, what is the fate of our patients? What is the fate of us? If I get into orthopedic, if I get into road traffic accident, I will be directed to a physiotherapy clinic and he'll be doing surgery for me. I don't want that to happen for myself, and I don't want anybody to have these kind of results in the future. But this is the precedent. If it is allowed, it is going to impact the nation in a very bad way, in a very big way that they are not seeing. They are just blind.
Thank you so much, sir. So I would like to point out here, I just remembered when Dr. Karthik Raja sir spoke, that what has happened is that Telangana Medical Council has written to the NMC asking the same question, and the NMC has categorically replied that no MDS maxillofacial surgeon or dentist should be doing this procedure. Now, instead of listening to the NMC, who the organization which holds the right to give comments on the same, the DCI and everyone has decided to go against the diktats of the NMC, and this is a very funny kind of a situation which has come up, because if today NMC starts giving a notification on that an MBBS doctor can do dentistry, then the DCI will not feel that it's beyond their control to comment on the same. So what is happening right here, that two statutory bodies of the government are going against each other for personal gains, and the Ministry of Health, who should be controlling these two bodies, is doing nothing about it and is just deflecting the blame. So with that point, I would like to go over to Dr. Akshay Samagani for his views on the same.
So the implications of the answer by the minister. So let's take it to the face value. It is the answer given by the NMC. What is the reality of NMC today is most of the seats, like more than 80% of the NMC regulatory body seats are vacant. Most are just appointed, ex officio members are there. So their answers are being taken. And similarly, the notification which you mentioned is signed by an accountant. This is exactly the state and affairs of the Medical Council and Dental Council of India. So in that case, what can we expect? And the implications in the ground reality is quite entirely different. So the orders given by the National Medical Council and dental, the reply given by the National Medical Council and the notification by the Dental Council has those very serious implications in the ground reality. For example, let me quote an example. An oral maxillofacial surgeon who is in Bangalore sees a patient of psoriasis without able to diagnose what it is, does a biopsy for 15,000 rupees, and which can be clinically diagnosed by most of us. And in doubtful cases, we do some simpler tests like bedside test. But these OMFS puts a board as skin clinic, and the innocent patient goes to the clinic, thinks that this is a skin expert, and checks with her, and the dentist does a biopsy for 15,000 rupees and finds out that it is psoriasis, and finally refers to a dermatologist. So this is the financial burden also, not just the deaths. So we should not ignore the financial implication which is happening in crores and crores together, which is happening because of just innocent patients going to such dentists who have put skin clinic and end up in losing their hard-earned money. So this is two ways I could see of this implication.
Thank you so much, Dr. Akshay. That was really a very nice reply. So before I ask the question to you all, I would like to tell our viewers that earlier it was thought that dermatology is a specialty which is for the elite people. That dermatology, the fees will be very high. There are not enough dermatologists in the rural areas. That is why the quackery is creeping in. But now what you all don't understand is that even in a state like Madhya Pradesh, which is not considered that developed as other states of our country, we are now about to have 40 medical colleges. The government is opening government medical colleges in every backward district, also in the rural areas. There the dermatology OPD is free. You don't have to pay a single penny either for consultation or for medicines. Many dermatologists like me have put a board outside their clinic that if you can't afford our fees, please don't pay us. Our fees is free. We see many patients throughout the day for free. So dermatologists have reached every nook and corner of the country. And because you all are not giving the dermatologists enough respect, what is happening? You are unable to eradicate leprosy from the country. Earlier we were seeing leprosy was being controlled properly, but now because of these quacks, the leprosy cases, the complicated leprosy cases known as ENL are rising. We are seeing them in our clinics. And also communicable diseases means diseases which can spread from one person to another, like fungal infections, dermatophytosis are spreading so rapidly that the day is not far like earlier days when a person from India had to enter the US or Europe. They were quarantined, active surveillance means they were put in one room for 1 week, examined, stripped down, examined, and if they had no disease, then they were let into the country. So if Indian fungal infections and dermatophytosis is allowed to spread like this, that day is not so far away. That is my first question, that what impact is this quackery having on communicable diseases? And the second question is, one story I want from all of you from your private practice. I will summarize that story with my own story, but right now I want one story from each and every one of you from your own practice, how quackery completely devastated the life of one of your patients. Just one story. So this time I will start with Dr. Akshay Samagani bhai only. So please answer these two questions as I have posed them.
So one very important is we are dermatologists, and as you mentioned, we are also leprologists and venereologists. Adding to the leprosy part, what you have told, I have seen, STD patients who have some, skin rashes all over the body because of the syphilis has been treated with, antifungals and with, depigmenting creams and with all expensive creams given by these quacks, and the patient ended up in having, advanced stages of syphilis. And we had to, treat him with, long duration of injections, painful injections, and all these things. And not just that, when at few instances when they have used the same syringes or unsafe the machines, lasers, and all this interventional part which is done by these quacks will end up in having even at times the high risk of even spreading HIV also. So these things have been ignored, and the government is thinking of that, as you told, there is no respect for dermatologists when we put our so much of energy and effort, spending 5.5 years plus 3 years, and we spend so much time in medical colleges giving free services, and our identity has been questioned. And that ends up, it's not going to harm us. We are educated people, we learn some or the other legal ways. But what about the poor patients who spend so much of their earned money and they want to get their skin cured? Dermatologist is not looking beautiful. It's about, having a healthy skin. So most of this thing, 80% of the clinical dermatology cases is what we see more than aesthetics. So in that case, so many real skin issues will end up going to these cosmetologists, and that will cause a lot of damage to the patient. And this is just one example which I could quote.
Thank you so much, Dr. Akshay. I would like to go over to Dr. Rajetha Damisetty, ma'am. Ma'am, please inform us on both these questions.
One extreme example that I want to share. There was this patient who was in coma. He was in ICU, and the physicians were trying to understand the cause of the coma. Incidentally, he also had some skin rashes. So day 4, day 5 after his ICU admission, somebody decided that, when somebody is in the ICU, dermatologist is not a specialist who is generally called upon. But because they were at their wit's end, then the dermatologist was called upon. Luckily, we were able to identify that what the patient had was one extensive tinea, extensive fungal infection, and he also had broad stretch marks. They were like purple. We call them livid, angry looking ones. The story was that this patient had gone to a quack with complaints of dark underarms. So he was given a strong steroid cream. So he kept using it, and then he developed fungal infection, and the quack said, you keep using it there also. So that kept happening. Then one fine day, this patient, unfortunate patient, decided that this cream is not helping, that the problem is spreading. So he just stopped the cream. And because of this, he went into a Edisonian crisis. Basically, the steroid absorption was so much in his body that his body stopped producing steroids on its own. And when the externally applied steroids were withdrawn, he went into a coma. So luckily, we managed to save the patient, save the day. But this patient could have died if the intensivist had not thought of calling the dermatologist at that point of time, because they were not, this was a relatively young person. They did not think of Edisonian crisis. They did not think of doing a 8 a.m. cortisol. They've done so many tests and nothing was giving them a clue. So this is an extreme example.
Thank you so much, ma'am. Now I would like to go over to Dr. Karthik Raja, sir.
I have two case examples to share. Number one is there was a paniculitis. The patient was having scars in the scalp and there was no hair there. They have been given 12 session packages of PRP. They have been doing PRP in the scalp to grow hair where the scalp cannot grow hair. There is a scarring alopecia and they have been doing that. It is done by a dentist. So the patient lost trust in the medical system itself and he went to some native medicine. He had these legumes and stuff which was unregulated because he lost system in the regulated medicine format. He went to unregulated medicine. He started having this arsenic bismuth kind of legumes and he ended up, he died because of heavy metal toxicity. Okay, he got liver failure and then renal failure. Both happened simultaneously and he passed away. But the core problem was he was having some other issue where the PRP was done by a dentist for 10 packages which was charged him 2.5 lakhs. Doctors, dermatologists don't charge that much money for PRP, but they are charging and they are depleting the resources of the patient. That is one case. Another case, again by a dentist, given biologicals for psoriasis. We all know that for the biologicals, we will give it in a hospital setup. We won't give it in the OP setup. We are very scared of it. We know something might go wrong. We will do all the investigations, but zero investigation was done. The biologicals were given, and the beauty of entire scenario is it is not psoriasis, it is tinea infection. They have given biologicals for tinea, thinking that is psoriasis. So these are the two cases I want to share.
Thank you so much. So see, viewers, again, I am trying to tell you that there are 2 points to this question which our people are answering so well to you. One is the anti-quackery scenario which they've seen in their OPD, and other, how is it spreading communicable diseases. So like Dr. Karthik Raja sir just now told you, it was a patient of tinea in which a medicine for psoriasis was given. So now that tinea is going to, that fungal infection is going to spread to thousands of people and it's going to devastate the life of so many people. Any white patch can be a patch of leprosy. That is only us dermatologists who can examine and tell you. It is not easy to examine. So many times we have seen the leprosy patch being treated as vitiligo by these people by giving them again wrong medicine, and then the leprosy spreads and the patient spreads the disease all over the society. Cutaneous tuberculosis is misdiagnosed most of the times by the quacks, even by non-dermatologists, and all these are diseases which can spread from one person to another. So these are the horrors which we are seeing in our OPD. With that, I would like to go over to Dr. Nazia ma'am. Ma'am, I would like to know your views on the same.
The question what you have kept here is very important because it directly affects the public health. In my experience, I do come across every day, like almost every day, the fungal infection patients, they are using corticosteroids. These corticosteroids ointments are being prescribed by so-called quacks, which they are treating. One specific patient I want to tell, just like the story is similar to Dr. Rajetha who told. A female patient, unmarried, she's 21 years, she came to me with stretch marks all over the body, from axilla to breast to abdomen, thighs, everywhere. It was like I was so shocked that some hormonal things and all. When I took the history, I realized that she has been using topical corticosteroids for fungal infection, and this is the story. It's so tough to treat those stretch marks because she's an unmarried female. What about her future? How is it going? She getting married? And one more story I just not told about the laser treatment which was done by dentists specifically. I will mention the name also. They went to a clinic for layers. I have the evidence of those, and the dentist did laser, fractional CO2 laser all over the face, and it left trails on her face. The lines I could see just like marks. It was a challenging case, and the girl's wedding is just 1 month. Such difficult patients we get to see every day in our OP, and I feel very sad, I feel disappointed, and I feel very bad. How can people decide to go to a quack and non-dermatologist to show their face?
Here I want to pitch in. See, that is because they don't realize it is not a doctor. So a lot of people, educated people introduce me as dermatologist and cosmetologist, and I have to tell them I'm not a cosmetologist, I am a dermatologist. So But because people don't understand that. And there's one more very interesting twist that some of these people have given. They say that, we are going to do the glamorous anti-aging beautification stuff, and these dermatologists are going to treat the infections, the leprosy, the syphilis, and the tinea, and the fungal infections, and the psoriasis. So the problem is, once you start treating, how do you know whether the redness is because of some cream somebody has applied, or something called rosacea, or something like a tuberculosis of the skin? When you don't know the basics, how do you treat anything at all?
Very well said, ma'am. I would like to go quickly to Dr. Avinash Pravin, and I would like to have his views on the same.
Sir, actually, in India, the problem is the regulation of Schedule H drug. Every patient will go to the pharmacy buying these steroids for fungal infection, or the pharmacist giving some Glop G, some lightning, some steroid creams. So they keep on applying. So the regulation of Schedule H should come in place. Without the prescription, they should not give these Schedule H drugs. That should be come in first place. Second is, social media is propagating this thing. I saw a plastic surgeon who was put a reel telling that if you have this fungal infection, he showed some fungal infection, use cetaconazole cream. That is also a Schedule H drug. So a plastic surgeon who was running a pharmacy didn't examine the patient. He is simply telling in reels that if you have this, use this. So it could be any flexural dermatitis or eczema or anything. But he is telling use cetaconazole. So a Schedule H drug should be strictly regulated in India. And the second question to answer is, I saw a case who was having psoriasis. A dentist who told that he will cure psoriasis by doing excimer laser. He was given a package of 10 sittings. He charged more than 3,000 per sitting. I was charging 300 to 400 rupees per sitting. He was charging 3,000. He told a cure. I didn't tell I can cure psoriasis because it is not possible. A remission is possible. We dermatologists know. These people pitched in something and he lost 150,000 rupees in just wasting money with excimer laser with a dentist. And the same dentist is now putting reels on rosacea, on vitiligo. They give money to some layman. These laymen will act in the reels that telling that after coming to this place, the dental place, my vitiligo got cured. This is how the reel is scripted. Everything is scripted in social media. So social media also is a big thing promoting this quackery.
Just share one of my experiences. Event is there on my Facebook profile. My Facebook profile is an open profile. Anyone can see it. So I had a young girl who I was treating for vitiligo, white patches which you get for the layman to know. And that vitiligo was converted into stable vitiligo. The stable vitiligo also we were trying to treat in various ways. All of a sudden that patient, like many patients, stopped coming for follow-up. She stopped coming for follow-up. I also didn't remember what was happening. One day it was some holiday, Holi, Diwali, some place. So I work in a hospital setup. So at that time, in the accident or emergency, or some places we call it the casualty, a patient came who had slit her wrists. So I was called to examine the patient and to suture the patient. And I recognized the patient immediately. That is the same patient who I was treating for vitiligo. So I inquired about the history and I asked what has happened after treating her. So I came to know that, as Dr. Avinash right now said, that I was treating with vitiligo. There will be remission, there will be relapses. We never say that we are going to go for a magical cure. That's not even legal to say in this country. But that person was treated by a so-called homeopathy person. I don't know whether that homeopathy person was even recognized or registered or not. And that homeopathy person stopped all the drugs which we were giving the patients. And that patient ended up having a flare of the vitiligo and the whole body was covered with white patches. As a result, her fiance left her and she went into depression and tried to commit suicide. Luckily, in this case, we were able to save her. And I am a positive person, so I always come up with positive examples. There have been so many cases in which we've not been able to save the patients and the patients have died because of quackery. I'm not even bringing that to the audience right now because I want the entire sentiment to be positive. So that is how serious quackery is, and that is how quackery is going to affect you. Now, before I go to the next section, I would like to educate all of you that when you go to a clinic, the doctor should be registered with the particular state medical council. Like I am from Madhya Pradesh, my MBBS degree and my post-graduation degree should be registered with the Madhya Pradesh State Medical Council. Then my clinic should be registered with the chief medical or health officer or the district health officer, as it is said in some states and districts, because that medical officer is the competent authority to ascertain that my clinic is safe for the patient. There is fire NOC, the pollution control board certificate and NOC is there. There are other compliances which I have fulfilled in my clinic. So whenever you go to a qualified doctor also, you are free to ask for our degrees, for our registrations, for the clinic as well as our registration. In most of our clinics degrees and registrations are either outside or inside our OPD for everyone to see. That is the law of the land. So that is how you can understand whether a person is quack or not. And in most state medical councils, you can take the number which we have provided, the registration number. You can go online and check whether that number is genuine or not. So I urge and I implore and I request all the patients to do that before you go to a doctor. We won't feel insulted. We write our a registration number even on our prescriptions. Please ask us also for our details. We will show them to you very proud. Point which I have brought in front of all of you. Now I will again educate my audience about some matters which are sub judice. We cannot discuss them in this podcast, but we are just informing you so that you know that we are also fighting your battle at our end as hard as we can. But we need all of you to pitch in into that fight. So there is a case in Madhya Pradesh High Court against quackery in which notices have been issued to the government. The government in a very cowardly manner has decided not to reply to the notices, but the government has set up an anti-quackery unit in every district, which is mandated by the NMC Act, but at least in MP it has been implemented. Obviously, that anti-quackery unit is not working right now, but they have set it up. The first step has been completed. And secondly, in Madhya Pradesh, if you have to register a clinic which says skin or hair, a dermatologist degree is compulsory. Without that, you cannot register a clinic in the name of skin or hair. So at least that much we have accomplished. But still at the ground level, the things are very bad. Because clinic may be a dental clinic, but they'll put a false board saying skin and hair. And there is no power which the CMHO has. They don't have the hands on the ground so that they can stop such clinics from functioning. That is why you patients need to complain you patients need to go to the consumer forums. You patient needs to go to the court so that such people can be rooted out from the system. Another case is going on in Tamil Nadu. Again, the IDVL is fighting on your behest so that quackery can be eradicated. Again, the government is not replying properly. The NMC is not giving the replies as it should. Another case is going on in Bombay High Court. Again, the replies, as you know, the Indian legal system, the process becomes the punishment itself. So we are fighting a great deal for you all. And again, Dr. Rajetha Damisetty ma'am, I will request her when it's her turn to speak to also educate you about what they did in IDDAQ. So they have ensured that all drugs should carry the Schedule H warning. So at least we have ensured that there is now punishment for the crime, but the implementation of that punishment is not possible. Earlier, any drug could have been sold without any Schedule H warning. Now at least Schedule H warning is there. So if you have a drug in your hand which is Schedule H and you do not have a prescription, you can send the pharmacist or the quack to jail who has given you that drug without the prescription. So it is up to you patient to do that. Now I'm coming up with the question. I would like to ask each and every one of you. Again, I will start with Dr. Rajetha ma'am, that how has this social media menace, you have seen the doctors, the quacks, the pharmacists, the dentists, some people are just 12th pass also.
The patient was having scars in the scalp and there was no hair there.
Types of stuff and promoting various Schedule H drugs and spoiling the entire health scenario of the country. What are your views on that? And please tell us a little bit about IDDAQ also.
The patient was having scars in the scalp and there was no hair there.
Stands for IDDAQ Task Force Against Topical Steroid Abuse. And thanks to IDDAQ and particularly to IDDAQ, in India, steroid creams came under the prescription medication banner. Otherwise, they were legally allowed to be sold. They were also legally allowed to be advertised.
The patient was having scars in the scalp and there was no hair there.
A mid-potent steroid, nobody in the world, including our poor neighbors like Bangladesh and Nepal and Sri Lanka, have these combinations. Only we Indians have this, and these were being advertised and sold without any regulation. Now also they are being sold, but there is regulation, and at least there is some hope for us that, recently a friend of mine had ordered them on Blinkit, and in Blinkit you get them super quickly. Within 15 minutes you're getting these super potent topical steroids that could ruin your face forever. But at least we are working on a case against Blinkit for it, because earlier days, before 2017, before our PIL in the Delhi High Court, we could not even have gone to court for it. So that is one. Second thing, Social media has made digital quackery our new reality, but in multiple ways. One, because misinformation is easy, it is cheap. Earlier, if you wanted to start a practice, you wanted to be known. You had to either sit and work for decades or years, or you had to take out these expensive conventional advertisements in the newspapers, in TV channels, and that was not easy. But now everybody with an Instagram channel and with a who's understood the algorithm of Instagram can make a reel, can make it provocative, can make it, can do this, use this clickbait and then attract views. And also, it's so easy to do these morphed images, to Photoshop pre-posts, to make fancy reels. So it is thanks to this that quackery has gone to this current level where it's, they have grossly outnumbered the real doctors. The fake doctors of today outnumber the real ones.
Thank you so much, ma'am. Now I'd like to go across to a social media expert of sorts, Dr. Avinash Pravin, and I'm asking you a very specific question. The question which I'm posing to you is that how can a layman spot a quack online? Means what are the things which a normal dermatologist or doctor will never do, these quacks will always do. So as they always say that a dermatologist will be known for his credibility, not for his visibility or online presence. So how are these quacks visible but not credible? Please inform us, Dr. Avinash.
So it is actually a very tricky question in social media, but I can simplify. The first thing is the degree. These quacks usually use a lot of jargon of words like Germany, aesthetic course like FAM, Ilamed, all these aesthetic courses, Germany, UK, USA, MSc dermatology, all these kind of bio. In the bio, you can see a lot of different country names are there. Other thing is most of the influencers, whole digital quackery can be influencer driven or non-influencer driven. So influencer driven quackery, same thing, they pitch in like visible results in 2 weeks or 3 weeks, which is driven by the company. All these kind of quackery is happening. So for a layman, actually speaking, they are getting confused because they couldn't see what is real and what is a real. That kind of problem is still there. We all dermatologists are trying to bust these myths, everything. We're still trying, but we are trying at one end, they are distracting in another. This is what is happening. So it's a big challenge actually.
I would like to now go over to Dr. Karthik Raja sir, who has done a lot of myth busting of himself. I would like to ask Dr. Karthik Raja sir, how does it feel where sometimes even qualified dermatologists behave like quacks? They tell about Schedule S drugs, or qualified doctors behave like quacks. And what is your opinion on people who are going for shortcuts, all these Ilamed and all these fake courses on which even legal action has been taken? When people are advertising these fake courses, how does a normal patient differentiate and how do you deal with it?
So number one, about the Ilamed issue, let us tackle first. All these fake qualifications are actually fake qualification unless until your medical council you are able to register as a specialist. You are not a specialist in the field. That is the end of it. All the other extra qualifications comes after dermatology. As Madam has told, diagnosis has to be first. Then only the treatment will come. If you are not able to diagnose, you are not supposed to treat. All these aesthetic physicians are telling the dermatologist will treat the disease only. We will only take care of the beauty part of it. No, there are aesthetics everywhere. There is aesthetics in building, but in building architecture will do the aesthetics of a building. There is aesthetics in the dentistry. They will do teeth whitening, dental angle correction, all those things, the crooked tooth correction, all those things the dentistry will do. There is aesthetics in skin, what the dermatologists are the only person who is supposed to do. Any other extra qualification is not valid, irrelevant, and they are not supposed to be doing it. And if you go to them, they may do the procedure without knowing what the problem is, and you may end up with new problem rather than solving the problem. That is number one. That is a very, very sad state of affairs. These are usually done by freshers and pass outs, and they are lured by these people, marketing agencies, who are sending them bombardment of messages stating you do one reel, one post, we will give you 15,000. It starts from 15,000. It has gone up to 5 lakh and up to 10 lakh. I have only 15,000 followers. I have gotten a request to post a reel about a famous company, about one product, and I have been offered 3 lakhs. It is very enticing, and for a new dermatologist or a newcomer who is not even started a practice, it is going to be a very huge amount of revenue to resist. So that is the problem arises. I feel all these dances are because of these kind of reels and offers. There should be a regulation that none of these medical grade products should have any advertisement. They are not supposed to have a PR agency. They are not supposed to come into any other doctor and offer them any money to do a reel. Those people also should be punished. Then only this menace will stop.
I want to say two things. Now, not only patients are getting conned, even young MBBS graduates and BDS graduates are getting conned. So, you all know about this Quackery-free. Quackery-free is one very notorious training institute which calls itself a council. And they have been getting BDS graduates into paying them lakhs of rupees, cheating many of them, promising them that they are allowed to legally practice cosmetology. This training gives them a license to use lasers and injectables on patients. So, this digital quackery is creating quacks and is also getting these quacks closer to the gullible patients. The other thing is regarding only freshers being conned. Greed does not know any age. And once you start getting into it, it starts feeling normal that instead of patients being seen every day, you just go put on your makeup and then do 2-3 reels and then make a few lakhs every month, and it seems very cool, and then you start thinking that maybe this is normal. And all we need is 4 or 5 people to set a bad example and to mislead our youth.
I would like to take this opportunity to inform all the dermatologists and the doctors who are viewing this, and also to all the patients who are viewing this, that us conventional and ethical dermatologists have huge practices. The word of mouth which a good patient will bring is worth its weight in gold. One satisfied patient will bring you 10, 10 will bring you 100. That is how we multiply our patient base. And all of us have made empires out of our practice. We have houses, we are very well to do, and our patients stay with us forever. This kind of social media presence is very temporary and very futile. The biggest social media influencer who started influencing social media even before many of us were into the social media game was Logan Paul. And what is he doing today? He's become a fighter, he's become a boxer, he's not doing YouTube videos anymore. So he became famous from YouTube and then shifted his base. So you already have the opportunity of a primary occupation being there. You're leaving that and you're thinking that online you are going to be this joker, this dancer, this clown. You're going to break the law because endorsing any product is illegal. Your degree, your registration can be cancelled for it. And secondly, Schedule S drugs. What about the promise you have made when you've done your MBBS, the oaths which you have taken? Where has all of that training gone? You are treating your own Instagram profile for like sold to the highest bidder. It is really pathetic, and in the long run you will have to pay for this, because ethics is not something which you are doing as a favor to us. Ethics is the surest way to get permanent success. The quickest and surest way to get permanent success is ethics. With that, I would like to go over to Dr. Akshay Samagani bhai, and I would like to have his teacher also of his field. So I would like to have his opinion on the same.
First thing first, patients should not rely for prescriptions on social media. Facebook, Instagram, all these are for entertainment. Nothing more than that. If you have any skin issues, you should consult a qualified dermatologist, and you have to take in-person assessment, then take the prescribed medicines. And don't take your skin lightly. It is the largest organ of your body. Never play with your skin. Secondly, to all the dermatologists and the doctors, yes, you should never endorse any of these products to anyone, to anywhere, in any form. So this has to be kept in mind, and many instances have been, the medical councils have punished for endorsing products. Just to remind, even a water filter was endorsed, and there was heavy fine on doctors and the group of association which endorsed, water filter. This is one example I could quote. There are many examples where you are not supposed to endorse anything on social media platform.
Thank you so much. I would like to go over to Dr. Nazia ma'am for her views on the same.
That's what I totally agree with all the speakers here about their views, that it is not at all ethical to endorse the products on social media. And what I feel that, to endorse and to advertise is unethical. We have read in our MBBS, in our textbooks, that to advertise and give advertisement itself was not ethical. It has to be a service-based message we have to give. If at all you want to give in social media, it has to be something like service-based and clearing their wrong views and wrong opinions. That has to be the motto of being on social media, not that you are giving prescriptions or telling about the products. That is very mean of what some people are doing on social media. I feel very sorry for that.
Thank you so much, ma'am. So, to end this section, and now we are coming towards our last section, I would like to tell you all that all of us know how Baba Ramdev, the notorious guy, was pulled up by the Supreme Court because he was making all false claims in newspapers, on news channels. He was promoting his own drugs by himself. He was actually cheating all the honest Ayurvedic doctors also. And one of his products, Coronel, which he said first could cure corona, he killed so many people. But because of the kind of system we have in India right now, he's not been punished right now, but he's been reprimanded by the Supreme Court. He had to bring down all his advertisements, and he had to apologize to the Supreme Court. So if you want to become a person like Baba Ramdev, why did you do all these studies? You could have become Baba Ramdev without any studies also. My final thoughts on this is that if you are a patient and if you see your doctor dancing and telling you medicines, that doctor doesn't want anything good for you. The medicines or the products which they are telling you now is going to harm your health even further and is going to make you dependent on some kinds of things. So please avoid such doctors. Go to an ethical doctor whose main attention is towards healing you and not towards cheating you and exploiting you. So now we come to our last section. All these questions which I have asked have been from the patient's side only, have been from the viewer's side only. So the last section is that viewers are very confused that, sir, now Amazon is also offering us a consultation for 100 rupees, 200 rupees. AI has come in, so can an AI tool substitute the work of a dermatologist? Will the chatbot be able to tell me what disease I have and give me a prescription for the same disease? AI is going to the next level. And when they are filling in their prescriptions through some online platforms, that online platform is saying that, we will give you 1 free consultations. To all of you patients, I would like to tell you, we doctors, this is not allopathy, this is modern medicine. Modern medicine is based on evidence-based medicine, meaning we do randomized, double-blind, controlled trial, meaning neither the person who is observing the effect of the drug nor the patient knows that which group has been given the placebo, which group has been given the real drug. So there is no bias. There are various systems of trial which will take a long time to explain, but through that we establish the evidence base. And we are very open people. We will be the happiest if evidence base comes in Ayurveda also. If evidence base comes through some alternative medicine also, we will be happy to accept it. But unfortunately, right now the evidence in other forms of medicine, in other forms of alternative medicine are missing. Like homeopathy is working on serial dilution, which is not evidence-based. They say that the more you dilute a substance, the more powerful it becomes. Even a class 8 science student will debunk that fact. And people ask that if that is true, then why do the rivers which keep flowing, if you mix poison in the river at the top, at the origin, then at the bottom, everyone should die because the regurgitation is taking place. So by the time it moves down, it should become more concentrated. So such kinds of myth exist in the country. So when you go for an online consultation, most of the drugs are not allowed to be written online. Without a proper examination, in one of my patients, the artificial intelligence diagnosed a tinea, a fungal infection as melasma, and prescribed medicines of melasma, which is a pigmentation which mostly women get. He diagnosed a male with males can also get melasma, but that particular case was not melasma. That was a fungal infection which was misdiagnosed as melasma in that particular AI format. So now I would like to ask one by one all of you, starting with Dr. Karthik Raja, that what do you tell the patients who say that, so Dr. Karthik Raja, please tell us your experiences on the same.
Yeah, I'm going to be very brief. I'm going to tell about the online products purchase. I will never trust anything for my health from online, because I have even bought a laptop from Amazon which happened to be a counterfeit. When I went for a warranty claim and not that it is counterfeit. Recently there was a drug bust happened in Hyderabad as well as in Delhi as well as in Bihar also. They have been making counterfeit drugs of the original drugs and selling it to the companies who are selling without bills. So these things can happen in online. Again, for the bulk discount, they will be erasing the expiry date and they will send the short expiry medicines to you. Those have happened to my patient, and also a lot of counterfeit medicines have been happening. When you check and open the deep and see the consistency, that has happened. If it is through a pharmacy, the pharmacy fellow, at least by the second patient, he will get a complaint, he will revert it. But online, who are you going to complain? That is one important component about buying drugs from online pharmacies. Number 2, about AA. Okay, listen, AA. If I am using AA for healthcare information, I know what bullshit it is telling. I will be able to figure it out and I will be able to correct it. But if I am using AA for law, or if I'm using AI for coding, and if I write the code and put it on website, it is not working. There are some flaws which I'm not able to figure out. Only a technical person who is using AI for code writing will be able to figure that out. Only a lawyer who is using AI for law drafting will be able to figure out the mistake that AI is making. Likewise, if you are going to give AI your health, you are going to think you are having cancer. That's all.
Very rightly said. Chat GPT will lead you to either cancer or AIDS. Those are the two things which commonly they lead everyone to. So I would like to ask the views of Dr. Akshay Samagani on the same.
So this has not been a new thing. In past decade from till now, people used to Google it, ask the symptoms and find out what do they have. And Google used to give some answer, and we already know that it either, as you told, it's either a headache, can be a cancer, or something going to be a sure shot death. This is nothing but a more refined version of Google, and betterment version of that. All the AI does is collect the information and come to some random inputs which will give, which cannot be compared to the wisdom of a doctor who has gained the experience minimum of 10 plus years and knows what is right and what is wrong at many times. And even though we do clinical diagnosis, we do a lot of test investigation, confirm, and then decide among the many drugs which is already available. Even though your AI gives a list of drugs and you see the best which is a drug of choice and you give, but in your situation that drug or the condition is not right, and that might affect you in a bad way. So that's where a wisdom of a real person, the in-person consultation and the doctor's touch gives the difference. AI cannot replace a real doctor in any time soon.
Dr. Avinash Pravin, brother, please your views on the same.
All the online platforms, sometimes if you see, they are not checking the Schedule H drug or any prescription based. Just like that, you can order these products and these people are getting, like isotretinoin, even some Schedule H drug, which should be with the prescription. Or sometimes what they do is all the hair loss platforms. You buy these drugs, like the supermarket, you buy minoxidil tablet, finasteride. After that, after you pay the money, someone will call from the online platform and just call them like MBBS doctor, someone, and tell that yes, use these drugs. This kind of ulta treatment also is happening online, which should be regulated also.
Thank you so much, Dr. Avinash. I would like to go over to Dr. Nazia ma'am and ask her opinion on the same.
Like we are seeing so many apps nowadays and so many things, we are giving treatment on phone, Facebook, laptop. I think that the human connection, just now doctor has mentioned about the human connection, the empathy, what we show to our patients definitely matters. We have the touch of empathy along with the knowledge and wisdom, the experience what we have gained. Such things, they cannot be treated. It's not a same treatment for all the patients, similar treatment. Definitely going to, we see everyday patients who have already used their online products, online prescriptions, all the things what we are sold on Facebook and Instas, and then they come to us, then they find the treatment.
Thank you so much, ma'am. So for the last speaker and of the last section, we have Rajitha ma'am to guide us on the same topic. Then I will summarize everything and we will call it a day. Rajitha ma'am.
So I'll tell you what I tell the patients who come to me saying, I put my symptom in, Chat GPT thinks that I have cancer or I am going to die of this infection, a fairly common thing. And then we get these emergency SOS calls saying, I have to see you now, I think I am dying, kind of thing, which is very strange for a dermatology setup to be hearing. So I ask them that if you have to build a house or get your, interiors of your apartment designed, would you ask ChatGPT? When you can't even trust it for something that is non-living, for something that is renewable, meaning if not this house, then you can build another house. God has given you one body. It is a non-renewable resource. How would you trust something that doesn't understand what's going on? So ChatGPT has been documented to lead a teenager to suicide rather recently. We all know that whatever you can lead it into certain questions. Suppose you say, do you think these symptoms mean that I have cancer? Then it will start directing you towards it. I think that it is not cancer, or is it possible that it is not cancer? Then it will say, yeah, it is not cancer. So it is, finally each individual has to take responsibility for their own good. So when you go to a doctor, when you're following somebody online, When you're asking ChatGPT, please use your common sense first. Take responsibility for this one body that you have been blessed with.
So for our viewers, I would like to summarize that when you are going in for this 100 rupee consultation from Amazon, you don't even know who is writing your prescription, whether it is a plain MBBS, whether it is a dentist, whether it is even a doctor, or it's just a doctor's sign which they are using. Many drugs which we prescribe after proper blood investigations. Like just now Dr. Avinash mentioned oral minoxidil. Have you taken the BP of the patient before giving the oral minoxidil to the patient? Have you done a LFT or a kidney function test, renal function test? You've not done any of that. This is greed at its peak. Like Rajitha ma'am said, Amazon people are using your body in worst ways, probably just selling your body. They are exploiting your body. They are giving you medications which you probably don't need. They don't do a general examination, which all of us doctors do. They don't do a systemic examination, which us doctors do. They don't order any tests. As rightfully said, once ChatGPT has led someone to suicide, and on the other end, this was on Times of India, you can Google it also, ChatGPT made a person who had an advanced stage of cancer believe that they have nothing. And through naturopathy, they can be cured. And that patient not only lost their life, they suffered a lot because of ChatGPT. And we had a huge national conference in Madhya Pradesh in Jabalpur, in which all experts were called from all over India, from all fields of medicine. We sent our recommendations to the government also, to the ChatGPT programmers also, that there should be some firewall, some protection for technical and medical, mainly medical information. No one should be able to write to ChatGPT. ChatGPT learns through your wrong responses also. So if some quack has put up an article online which makes no medical sense, ChatGPT might learn from that article also. Similarly, what, like Dr. Karthik Raja sir said, what we extract and what we infer from ChatGPT, can only a doctor can understand what that information means and whether it is correct or it is completely false. So a normal person should not be made privy to that information. But right now, ChatGPT is or Perplexity Pro or anyone is a free-flowing platform. No registered doctor is treated as a registered doctor on that platform. So imagine, anyone can post to be a doctor and upload something to ChatGPT through their database, and any normal person can take out any information which they will not understand also and take that drug. So ChatGPT sooner or later will be held responsible for what they are doing.
All these AI platforms come with a disclaimer. They very clearly say that these are not to be used for the diagnosis or treatment of any health condition, that they are not a substitute for professional health care. So they are not going to be taken to task. Finally, it is the patients who are going to suffer.
Ma'am, you are absolutely right, but that is what we doctors will in the future challenge, that you can't just write a disclaimer and keep doing the same thing. You tell people that alcohol is bad for you and then keep advertising alcohol. So that is why the advertising for alcohol ultimately stops. So now we are coming to the end of today's podcast. I would like to thank all our panelists. All of us had very busy days of OPD. It's almost midnight now when we are recording this, and the only reason why we are recording this, that we are all true patriots. We are Deshbhakts. We are doing this so that the health of our country, of us Indians, improves, so that foreigners don't come to our country to see how tuberculosis looks like, how leprosy looks like, because leprosy and tuberculosis have been eradicated from their country. We want India to be shining in the real sense. We urge our ministers, we urge our politicians to please do something about the healthcare. The healthcare in India is in shambles right now because of these quacks. If you don't control these people, this infection can infect your own relative, your own self also, and even the best of the antibiotics, the best of ICU and ICCU care will not be able to save you. Thank you everyone for joining us today. Jai Hind, take care.
Thank you, sir. Thank you.